Hello, I'd like to welcome you to Farrior Facial Plastic Surgery. My name is Dr. Edward Farrior. What I want to discuss today is facelift. Okay, what is a facelift? Well, it's a very specific operation that addresses truly the lower 2/3 of the face, meaning everything from the cheekbone to the clavicle. A facelift does not rejuvenate the eyelids or the forehead. Those are accomplished individually with either a brow lift or upper and lower lid blepharoplasty, which is the medical surgical term for a facelift is a rhytidectomy. Rhytidectomy means the excision of wrinkles. Now, the more specific scientific term would be a cervical, the neck, facial, the cheeks and jawline, rhytidectomy. So cervical facial rhytidectomy. It is not really designed to address the fine etched lines that occur in the face. That needs to be addressed with some form of resurfacing. So, who's a good candidate? Well, most people that consider facelifts are between the age of around the early 40s to the mid to late 60s. So, how does a facelift perform? Well, classically, the facelift started as simply the excision of excess skin. It then evolved to more the elevation of the connective tissue, or what we call the SMAS, which is the superficial musculo-aponeurotic system. What does the SMAS do? Well, the SMAS is the muscles and connective tissue of your face, which allow you to animate, to smile, to frown, to do all of those things. In the early 90s, a deep plane facelift was described. This facelift included more the release of ligaments attaching the facial skeleton to that SMAS, particularly the mandibulocutaneous ligament here, which helps to create the jawline that we get where it puckers here but seems to be stuck along the jawline, and the zygomatico-cutaneous ligament, which is up here. Okay, so when you release those two ligaments, you can more fully reposition the SMAS, that connective tissue, in the volume of the face. So the fatty pockets that are within the face to reposition the volume, support the skin, and then you can be much more gentle when you excise the skin, meaning it's not pulled tight and it is not distorted, creating a facelift appearance. That appearance came primarily from trying to pull the skin too much and not lifting and repositioning the volume of the face. What is accomplished by doing a deep plane facelift? A more natural result, more longevity, so the result lasts longer. But what you accomplish by doing that is you get a result that's going to last from 10 to 15 years versus 5 to 8 years. Okay? Now, with all facelifts, if you have one, you are never going to look as old as you would have looked had you not had the first surgery. Reason being is there's a finite amount of skin. Skin can stretch a finite distance. And so if you remove some of that skin, it cannot deteriorate over time as much as the original volume of skin could. Now, the expectation is refreshed, rejuvenated, young for your stated age. The expectation is, obviously, you have to have incisions to accomplish all this. Well, where are these incisions made? In both the male and female patient, there is an incision that follows the margin of the ear to camouflage the incision at the transition of tissue types, it is also placed on the posterior surface of the ear to assure that it is completely invisible to observers. Then it depends on two factors: the degree of laxity in the neck skin and the position of the sideburn tuft of hair. Okay? It's more so in females than in males with regard to the sideburn tuft of hair, because a male can grow the sideburn a little lower from the beard and compensate if this hairline is elevated. There are two ways to make facelift incision. You can either make the incision at the hairline, so you follow the margin of the hairline, both in the temple and behind the ear, or going into the hair. If you go in the hair, especially in the temple, you're going to elevate this hair, because if the incision is here and you want to lift this, what's in between? This hairline. For that reason, my personal preference in 95% of patients is to make the incision just barely inside the hairline. That way the hairline is preserved and that incision will heal imperceptibly. Hair will grow back out through the incision and camouflage that scar. Yes, if you get in front of a magnifying makeup mirror, you'll be able to see a fine line within the hair, and your hairdresser will probably be able to see that fine line. A good way to check out your surgeon is to ask your hairdresser. Ask them if they've seen any incisions from that surgeon, and they will be able to tell you, yes, his incisions are excellent, they heal well, I can hardly see them, or his incisions are not as well camouflaged. After you make the incision, you elevate the skin really out to about the cheekbone, the angle of the jaw, and then in the posterior neck. That skin is left in place at first. Then you enter that deep plane, which is an incision in this mass, and the meticulous and gentle dissection of this mass away from the underlying muscles and skeleton, and the tissue is lifted off of that deep tissue. Those ligaments I discussed earlier, the zygomatico-cutaneous and the mandibular-cutaneous ligaments, are released, and then that mass is repositioned and sutured in place. Then the skin is redraped and excised. The closure of the skin is very important. It needs to be done meticulously and in multiple layers, so that alignment of the two margins of the skin is as perfect as it can possibly be. Now, what's the recovery like? Well, initially, there will be a dressing in place for 24 hours. You will come back the day following surgery, that dressing will be removed. After that, there'll be bruising, there'll be swelling, there'll be numbness. To summarize things, initially, your face will feel different to you for 6 months after surgery. Don't expect to feel normal. Day 3, day 7, day 10, day 21. It's not going to happen. The numbness that occurs in front of the ears and behind the ear, that will last for at least 6 months. There will be tightness. You'll be thinking I'm walking around with my hand on your neck for 3 to 6 months. That's normal. That's just the body healing, nerves regenerating, scar tissue maturing and softening and becoming more like normal tissue. Can you have some persistent numbness? Yes. Have I had some patients that have had some persistent complaint of vague discomfort where the tissue has been moved? Yes, and that can happen with any scar, and it's completely individual from patient to patient. When can you return to work? Depends on the kind of work. If you're in sales, you're not going to be able to return to work for probably 3 weeks. If you work in a clerical position or can work from home, you will feel good enough to work within 7 to 10 days after surgery. You won't look good enough to greet customers, to go to board meetings and that kind of thing. So it all depends on what you do as your job. Now, my daughter's getting married in 3 months. That's okay. My daughter's getting married in 6 weeks. That's not okay. Primarily because you will look normal 90% by 6 weeks. You will not feel normal, okay? So you'll be self-conscious. You'll be aware of the fact you had a face and that you had surgery. Risk and complications with a facelift, well, it's elective surgery. It's elective for you. It's elective for me. That means if there was any high risk of a bad outcome, we would not be doing this kind of surgery. I'm a physician first. I made a promise to do no harm when I graduated from the University of Virginia Medical School. And if there was a great risk in facelift surgery, I would discourage anybody from doing it. Now, with all surgery, people bleed, and people have some injury to nerve. The nerves will recover, the bleeding is controlled, but that's why you get bruising. You can get a hematoma, which is a collection of blood. That will need to be drained if it occurs. How often does that occur? Probably less than 5% of the time. There can be injury to the nerve that moves your face because that nerve is right in this area where we're repositioning tissue. Typically, that injury is what's known as a neuropraxia, meaning the nerve is bruised or stretched or damaged in some way, but it's not separated or cut. In that case, the nerve will start to work by 3 weeks and will be completely recovered by 3 months. Okay? That's the typical injury of the nerve. How do I perform my facelifts? In other words, are you awake and you got to get through all this? No. I put the patients to sleep. It provides me the luxury of time to do what we need to do without worrying about how fast I have to finish because my anesthesia is going to wear off. So I have an MD anesthesiologist that will put you to sleep in my accredited office-based surgery center. So we're inspected on a regular basis. We are recognized by the state as an accredited office-based surgery center and meet and exceed all the criteria set by the state. So I appreciate your listening. I hope that this has been helpful and that you can take advantage of this information to make an educated decision, because that's the most important part of this entire process, is that you, the patient, are educated and make the right decision for you. Thank you for listening.